begin to look at and examine carefully, as we've done in the past, but ever more so in the future. Your communities serve as a keystone to building an architecture of service that encompasses all. In my examination of services in the United States, it's very apparent that we in public parks and recreation only serve about 20 to 30% and leave about 70 to 80% on the sidelines. The scenario is a rather interesting one because as we've grown in our public agencies, our services have become a topology of sport, of giftedness, and of eliteness. Dispatching those people who on occasion would be able to participate, but under the conditions do not have the skill, the money, or the support system to engage. It is critically important that we understand our service mission is to all, not a few elite who have the physical skills to compete, the money to support, and the family there to usher them to various venues. I find it fascinating. I visited my sister and brother-in-law in California recently, and my 7 and 9-year-old niece and nephew are engaged in youth sport, traveling leagues, high-level competition at 7 and 9 years of age. The cost to their family in excess of $30,000 a year. How many young children or families today can afford that? We've built a system which is exclusive, elitist, and it must be turned around. The work that we're doing at the University of Utah currently is focused on active living, a broader context than simple physical activity, active living for individuals with functional limitations, disability, and chronic health conditions. More specifically, we're working with public parks and recreation agencies, 4 agencies who tend to offer the very best of services and are classified in our state as the 4 premier programs. Those agencies are charged with the responsibility of meeting the needs of their community in full. But I've been very intrigued by 4 focus groups that we have conducted with children with cerebral palsy and other health limitations, their parents, and the public agency providers. There are very distinct differences between the perceptions of what I need from children and what my child needs from a parent's perspective, and those of those who are to provide the service. It is fascinating to me to see the parents point out signage at facilities which prohibit children from participating in exercise. These are actual signs. It's also amazing to me to see that they are unwilling to change policy in funding or other mechanisms that might bring a more full engagement in recreation and leisure pursuits, because we are funded by those individuals who subscribe to our offerings. That means sport leagues who pay large amounts of money, other venues where they charge for the venues. Whatever happened to a playground? Whatever happened to an area of a community center where free play might occur? Does everything need to be paid for? And might we actually use some of the profit that they make to invest in engagement? It seems to me that the examination and the careful examination of public policy is warranted if we are to meet our legal requirements as well as our social commitments to all. What I find fascinating is the change in healthcare and where we might be headed in the near future. Think of it. we're all facing an economic downturn of meteoric proportions. But what's interesting is that we haven't addressed healthcare in its magnitude and its purpose. We in America spend less than 5% on health promotion and disease prevention. The remaining 95% is spent on that which happens after you get sick, ill, or otherwise infirmed. We don't require you to do things that would keep your lifestyle and your capacity at a level where you can participate. What we allow to happen is for you to enter the costliest portion of our healthcare system, the emergency room, for your healthcare needs. What we have got to be about in our profession is the front line of health promotion and disease prevention. Richard Carmona, the previous health secretary in the United States, said, he was the Surgeon General, my apologies to Surgeon General Carmona, said that public parks and recreation and his address in St. Louis is the front line of health promotion and disease prevention. But we haven't stepped up. So preventing is important, but sustaining individuals is an opportunity that we can execute now and must. In terms of prevention, maybe what we ought to think about carefully is social isolation. If you factor this in, you can begin to link that to a variety of emotional and psychological conditions. You can also simply link it to dismantling a community and dismantling friendships, which should be the core of any community. Secondary health conditions do arise from our inability of early detection. Our public parks and recreation agencies should, in point of fact, have an opportunity for screening, and it should be part of an everyday experience. Let me tell you about something that we're involved in right now with the Brain Institute at the University of Utah. A while back, I had this sort of great idea, at least I thought it was, about how we might work with the people I tend to do research with in spinal cord injury, and how they might actually be on the front lines, the individual might be on the front lines of health promotion, disease prevention. We're looking at what's called a smart wheelchair, a chair that has the telemetry attached to it and a small little computer that will give every sign of your bodily functions. Quite Orwellian, I know. But in point of fact, it would send through telemetry up to the web and to the physicians and to myself the parameters of my performance each day, whether my heart rate was out of bounds, whether it was in bounds, whether a range of other indicators, including my seating behavior or seating relief. We now know that we can actually detect the onset of decubitus ulcers early, and in point of fact, should be able to prevent those. We don't have the technology to do that right now on a day-to-day basis, 24-hour, 7 days a week, real time. What we're proposing, and I think you'll see in the next decade, is real-time telemetry that could be on the person and available in your community to help them say, I need to get more exercise. I need to become more available and engaged with other people. One of the great engineers there was talking about the notion of actually measuring eye contact and having that linked up to the web. Eye contact is critical in establishing friendships and validating my presence. People with disabilities, people with functional limitations and chronic health conditions can be a central part of your community. Their health and well-being is what I would consider to be a capacity challenge. Each of us need to be working not only individually but collectively in building capacities. The capacity in each of the domains, whether it's in the psychomotor, the cognitive, the affective domains or others. It's critical for us to begin to accept that challenge and to work with individuals as they seek a healthier life. One of the things that I am excited about is the advent of transdisciplinary research. Finally, universities are getting it. We're actually reaching out. I'm working right now with a physician from Primary Children's Medical Center, a physical therapist and faculty member from Shriners Hospital, a community not-for-profit agency, and 4 public park and recreation agencies, all together to try and address the issues that constrain and serve as barriers to in public recreation to these individuals. We think that the possibility is there to remove those barriers, and through the engagement of parents, children, and the agency heads, we are looking at focus groups that will change policy and proposed research that we're advancing for funding. How can we, and under what conditions can communities develop and guarantee the benefits of leisure to these populations? First of all, I would say if we took 4 approaches. Next slide. Engage meaningfully all people in roles that result in policy formulation. Carefully examine the policies that you have now that restrict, constrain, or prohibit participation by all. Above all, provide an array of leisure opportunities, those that are non-consequential as well as consequential. We're all about winning. But you know what? Play's been around for a long time. Leisure experiences that aren't consequential have been here and will be here. Why not afford those to all? I'll leave you with this quote. Former Vice President Hubert H. Humphrey in the United States said one compelling statement. The moral test of government is what it does with those in the dawn of life, those in the shadow of life, and those in the twilight of life. I thank you very much.
Thank you very much, Dr. Compton, for this very well illustrated, without the pictures, presentation. Eh bien, il est maintenant 11 heures, moins 2 minutes. On est à la fin de cette session-là. Avant de vous laisser aller à toutes les autres activités de la journée, je vous laisserai comme directeur de la santé publique, et j'imagine que mon grand patron va être content, va être d'accord avec moi. Content peut-être pas, mais d'accord. Comme dernière réflexion, la réflexion suivante. Vous, les participants dans cette salle-là, êtes sans doute des gens de beaucoup de secteurs. Il y a beaucoup de monde du loisir municipal ou du loisir d'organismes de d'autres niveaux. Il y a des gens des municipalités. J'imagine qu'il y a des gens de l'éducation. J'imagine qu'il y a des gens donc de toutes sortes d'autres secteurs. Qu'on ne parle que de loisirs au sens large du terme, en partant des activités qu'on a mentionnées au cours des 2 dernières heures, les activités artistiques, les activités culturelles, etc., les activités sociales, les activités sportives, physiques, etc. Vous avez donc, vous qui œuvrez dans tous ces aspects-là des loisirs, vous avez sans doute plus d'impact sur la santé que les médecins et le système de santé. Les médecins et le système curatif de santé, au mieux, ont un impact d'à peu près 20 % sur notre santé. On leur doit 20 % de notre santé. Alors, il est relativement facile pour que les gens des autres secteurs en occupent une partie plus grande. Je vous laisse à cette réflexion-là. Les médecins de la société, ce n'est pas nécessairement les médecins qu'on pense, surtout quand on parle de promotion de la santé et de la qualité de vie. Je vous souhaite une bonne journée. Je vous souhaite d'apprendre beaucoup dans les ateliers auxquels vous allez participer. Merci. Merci aux conférenciers.